So the scenario, a client post gastric bypass surgery. So this is the idea. The main idea is patient just had surgery, gastric bypass. And what is the history of present illness? That means the condition. So this is a 30-year-old client with a BMI of 38, underwent a Roux-en-Y gastric bypass. So it's a gastric bypass. She has been struggling with a weight for several years. Surgery was unremarkable. And I give you a past medical history. She's obese, she has hypertension, she has diabetes, she has hyperlipidemia, and she has obstructive sleep apnea. Past surgery, she has never had surgery. Smoking, she quit tobacco 2 weeks ago before surgery, so she was still smoking. She has no allergies. So what have they given you? When you read these kind of questions, step back and just summarize it. All you told is a 30-year-old obese female with multiple medical problems here just had a gastric bypass. That's all. So something should be you start thinking about this post-op management of somebody with gastric bypass or what you expect. Okay. At 9 o'clock, patient doing well, vitals is fine, abdominal incision is fine. At 2300, okay, 11 p.m. later, you had a pop. Patient reported that she had a pop after coughing. And then when you examine the bowel can be seen outside the incision. Patient is alert, oriented, but she's anxious, and a heart rate of 105. So 11 p.m. at night of the surgery, she had a pop when she coughed. And when you examine the patient, you see bowel outside the incision. Patient is alert, she's not in shock or oriented, but she's anxious, so heart rate is 105, which is expected. What is the problem? Think and relax. Don't worry. Just step back. You know this information. Bring all the knowledge that you've learned before the exams. And if you get these questions, this is a typical question they will give you because it's a very good one. I have a 30-year-old female who just had a gastric bypass. All of a sudden, she had a pop when she coughed, and I can see the bowel outside. This is what we call evisceration. It's different from wound dehiscence. Wound dehiscence is just the wound completely is separate. The skin, the muscle, the fat, and the fascia, all of them is separate. And you can see the bowel through that, like that. You can see the bowel, but they are not outside. You see everything separate, but you can see the bowel still in the abdomen. When the bowel come outside and it's on the skin, yeah, this is what we call evisceration. This is a medical emergency. So in summary, I have a 30-year-old female who just had gastric bypass, now had evisceration. What will you do? So you click on the next one, and this is the question. Select 4 action. They've told you exactly what you should do. These are some of the questions. This is your select or apply. Different form of SATA. It's a kind of SATA, but it's a different select or apply. But they'll tell you how many questions you should pick or how many answers you should pick. You see, in the past, they don't tell you. You don't know whether 2 or 3. This one, they tell you, pick 4. If you pick 5, they will deduct mark. If you pick 3, you lose 1 point. So pick 4 so that they can, and if you get them wrong, some of these pick 4, you don't get any deduction. If you pick 4, all of them are wrong, you get 0. If 2 are wrong, you get 2 out of 4. So select 4 actions the nurse should take based on the presumptive diagnosis. I know this is what? Evisceration. Okay. Evisceration, there's certain things you have to know. As soon as you see it, the nurse, you remain calm. Stay with the patient. Let somebody call the doctor. You don't leave the patient anymore. Tell the patient not to cough or sneeze anymore. Place the bed in the very low Fowler position and bring the patient knee to the abdomen. So abdomen. So you flex the knee to the abdomen. Okay. Let somebody bring in sterile gloves, gauze, and saline. Soak it together and place the gauze over the bowel that has come out. Don't push them in. Never push them in. There's no need to push them in. Then you injured it. Okay. Then you check the patient vitals, Q 15 minutes. Every 15 minutes, you keep on checking their vitals. If there's IV fluid there, let it hang, and then you prepare the patient for surgery. This is emergency. That's all you need to do. Stay with the patient, remain calm. It's a priority. Cover the thing with sterile gauze and wait for the doctor. Tell the patient you shouldn't cough, you shouldn't do anything. So prepare patient for surgery. I'll pick this one. Push the bowel back into the abdomen. Don't pick this, wrong. Place client in low filer. Okay, very low bed. Left lateral D cube. No, if you put it in left lateral D cube, this is wrong. Okay, so don't pick it. But they ask you to pick only 4, so I'm picking 4. Take vitals every 15 minutes here. I'll pick this. Call HCP. This is a trap. If you see this, what did I say? Don't call AP. Let HCP. Let somebody call. If somebody is calling HCP, it's not you. So you call, you buzz the next station and you tell them, please call the doctor. But if you call, you have left the patient. So don't pick this. This is wrong. Place client in the low filer position with knee flexed, right? Knee is flexed to the chest. Okay, so this is perfect. Cover the bowel with saline soaked sterile gauze using sterile gloves. This. So this is, once again, they ask you to pick 4. You don't tell them which one is wrong, but you got to pick right answers. So we prepare the patient for surgery. Okay. We check the patient vitals. Okay. We place them in a low filer supine position with knee flexed and cover the thing with gauze that is saline soaked. And that is your 4. If you pick 3 and you get them all right, you get 3 out of 4. If you pick 1, you get 1 out of 4. They said pick 4, pick 4. If you pick 5 and one of them is wrong, and you get 5 all 5 right. All you need to do is you get 4 out of 5. Remember, they're not going to give you 5 answers. They only put 4 answers there. The rest are wrong. So there were 1, 2, 3. There were 7 question answers. 4 of them are right and 3 are wrong. So just pick 4 and you're fine. Okay. If you pick 4 and all of them are wrong, you get 0. 3 are wrong, you get 1 out of 4. Okay. So this is a typical question you should expect. Don't panic. I got you. Check Adapt NCLEX, and I will make you comfortable with this case study. This is what I do. I will make you don't even have to panic. And we will learn content and apply content to solve this question. Take care of yourself. And if you're going to take these exams, best of luck. If you're taking the current generation one, best of luck. Take care and subscribe to the channel if you have not done so. All the best of luck. Bye-bye.